admin.
Great. Okay. All right. Hello, everyone. Let's get started. Welcome and thank you all for joining us today. I'm Ann Casti, an outreach and instruction librarian at Minitex, and we have the honor of hosting this fall series on consumer health librarianship. Minitex is a Minnesota library organization that provides a variety of supports to libraries and schools across Minnesota, North Dakota, and South Dakota. We provide resources, professional development services, and expertise to help libraries better serve their communities. And we're proud to sponsor today's session. We will be hosting the event page for the series as well. And so that's where all the recordings and handouts will be stored and hosted. So you might see more emails about that coming up. The last session's recording and handouts are on that page as well. And we'll post that in chat in a sec. And we'll send the link to the recording as soon as we have it ready. So you may see more emails coming about that as well. All right, and without further ado, I will now hand it over to today's featured speaker, Catherine Chu.
Hi, everyone, and welcome to Effective Health Communication and Health Literacy, Understanding the Connection. I'm Catherine Chu, and with me is also Stacy Hendren. And Stacy and I will be your instructors. So I'm a librarian at the Health Sciences Library at the University of Minnesota, and Stacy is the library manager for the Northtown Library in Anoka County, Minnesota. If you haven't already, please register for the third session, Health Programming at Your Library, which Stacy will be leading on October 17th. And as you already know, with us is Ann, who will be helping make sure everything runs smoothly. And so big thanks to Ann and Minitex for making this series possible. I'm also really excited to have you all join us in gaining expertise in health communication and supporting your communities throughout Minnesota and beyond. So please reach out if you have any further questions after today's training. There we go. So before we start, a couple of housekeeping items to cover. So this session is closed captioned and recorded. All attendees have been muted, but please use the chat feature to ask questions or share comments as we go along. When sharing comments or questions, select all participants. You can adjust the size of your window using the plus or minus signs at the left. And the sessions are being recorded, and links to handouts, resource lists, and the recordings may be found on the Minitex series page the week after the event. This class is eligible for Consumer Health Information Specialization, or CHIS credit, through the Medical Library Association. We'll provide a link to an evaluation and directions at the end of the session, which is the first step in claiming credit for the Consumer Health Information Specialization. And Stacy will be sharing more about that at the end. And speaking of that evaluation, your feedback matters to us and helps us improve further events. So please take a moment to complete it, whether you want the CE or not. This session is interactive, so there will be links posted in the chat that will allow you to be engaged in the discussion. There will be handouts available later that contain links to the references and resources mentioned in the presentation. So let's get started. You may be familiar with some of the acronyms that are here at the center of this slide. NLM, the National Library of Medicine, which is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is the education and outreach arm of NLM. Its mission is to ensure that all health professionals have equal access to biomedical information and to improve the public's access to information to enable them to make informed decisions about their health. NNLM offers a wide variety of free trainings and webinars to support professional development and continuing education for librarians, educators, and health professionals. They also create free educational guides and toolkits that you can use and share, and sponsor funding and engagement opportunities. You can learn all about NNLM by going to their website at nlmn.gov. After this session, you will be able to define health literacy, describe universal precautions for health literacy, name 3 components of clear health communication, and finally, identify at least 3 online resources you can use as tools to promote health literacy. So let's take a look at our agenda. We will start with an introduction to health literacy, in which we'll cover what it is, why it's important, and the epidemiology of health literacy. Who is most impacted? Throughout this process, we will introduce you to tools which you can utilize to promote health literacy. Then we'll move on to communication. We'll discuss the concept of universal precautions for health literacy and best practices for communication. Next, we'll look at how you can use Medline Plus as a tool for reducing disparities in health literacy. Then we'll explore Ethnomed, an online tool you can use to reduce intercultural barriers to communication. And finally, time permitting, touch on some other useful resources such as the Indian Health Service. So, what is literacy, or why start with literacy? Sometimes the problem is not just health literacy, but the ability to read or write at all, particularly if English is not the first language. You may be more familiar with general literacy, which is often reflected in a simple question, can you read? General literacy is the ability to function in today's society and goes beyond simple reading abilities. Literacy represents a collection of skills, including reading, writing, basic mathematical calculations, listening, speaking, and cultural and conceptual knowledge. Health literacy challenges these general literacy skills by placing them in the complex context of the healthcare system. So while they're both connected, they are different. The definition of literacy has changed over time due to 1, changes in the physical materials that are used to display writing, such as computer screens, and 2, changes in the criteria that a given society or culture understands and measures literacy, such as social status or vocation. Literacy is more than just a reading level. There are 3 basic types of literacy. There's prose literacy, which is the knowledge and skills needed to perform prose tasks, such as the ability to search, comprehend, and use continuous text like instructions. Examples include editorials, news stories, brochures, and consumer health educational materials. Document or graphical literacy is the knowledge and skills needed to perform document tasks such as the ability to search, comprehend, and use non-continuous text, that is, text in short forms in various formats. Examples include job applications, medical forms, bus or metro schedules, maps, tables, and drug or food labels. Quantitative or numerical literacy is the knowledge and skills required to perform quantitative or mathematical tasks, such as to identify and perform computations, either alone or sequentially, using numbers embedded within printed materials. Examples include balancing checkbooks, interpreting blood pressure readings or lab tests, or keeping medical appointments. According to the American Medical Association, literacy skills are a stronger predictor of a person's health status than age, income, employment status, educational level, and race or ethnic group. So let's start with a definition of health literacy so we're all on the same page. Scott Simmons, a professor of health education at the University of Michigan, was the first to use the term health literacy in 1974 to describe how health information impacts the educational system, the healthcare system, and mass communication. The concept of health literacy was not introduced into healthcare literature until the early 1990s. Healthy People 2010 adopted the first formal definition in the year 2000, which stated that health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Health literacy as a concept progressed from describing and defining the literacy skills of the adult population to understanding that adequate, if not advanced, literacy skills are necessary to assess, navigate, and understand the healthcare system due to the increasing emphasis on self-management of health and disease. This definition was updated in 2010 with the passing of the Affordable Care Act. The new law added only one word to the earlier definition, communicate. The Affordable Care Act defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand health information and services in order to make appropriate health decisions. However, over time, researchers in the health literacy field felt that the previous definition did not go far enough, as it focused too much on the patient and their responsibilities or capabilities. The definition of health literacy used in earlier iterations of the Healthy People initiatives in the Affordable Care Act was updated and expanded in August of 2020, just recently, with the release of the Healthy People 2030 initiative. The new definition emphasizes people's ability to use health information rather than just understand it, focuses on the ability to make well-informed decisions and actions rather than appropriate ones, incorporates a public health perspective with personal health literacy be used to promote the health of others, and acknowledges that organizations have a responsibility to address health literacy. Although initially the responsibility for health literacy focused on individuals, there is increasing recognition that governments, health and community service providers, researchers, and consumer groups are also equally accountable. The adoption of a definition for organizational health literacy signals that personal health literacy is contextual, and the responsibility for health literacy does not rely solely on the individual. The definition also points out that organizations must be equitable in how they address health literacy. In its simplest terms, health literacy is the ability of the individual to find, understand, evaluate, communicate, and act or use the health information to make decisions. This applies equally to healthcare providers or patients as they both need these abilities. Helen Osborne, author of the award-winning book, Health Literacy from A to Z, Practical Ways to Communicate Your Health Message, says, health literacy is a shared responsibility between patients or anyone on the receiving end of health communication and providers or anyone on the giving end of health communication. Both must communicate in ways the other can understand. My health literacy definition has consistently focused on the goal of mutual understanding. For the purposes of this class, let's think of that Osborne definition as a shared responsibility between provider and receiver. A provider could be anyone who provides information, and the receiver could be anyone who receives information, a patient or library patron, or somebody reading a public health message. Why is addressing health literacy important? In today's healthcare environment, people are encouraged to take an active part in making decisions about their own disease process and to be engaged in shared decision-making discussions regarding treatment goals and approaches, potentially resulting in better health outcomes. However, the healthcare system isn't easy to understand or navigate. There are more medications, tests, and procedures. People have more options and are expected to be able to choose the best one for them. Shorter hospital stays, multiple pharmacy and healthcare providers, and the rising prevalence of chronic disease all contribute to the increasing role that people have in managing their own care. The simple answer is that low health literacy leads to poor health outcomes. People with low health literacy are more likely to visit the ER, and to have more hospital stays. One study showed that they're not only more likely to visit the ER, they're also more likely to return within 2 weeks. This makes sense because health literacy impacts one's ability to follow discharge instructions and follow treatment plans. Low health literacy can act as a barrier to effective disease self-management. This is especially true for chronic conditions that require complicated self-care regimens. People with limited health literacy are more likely to skip needed tests and underuse preventive health care. People frequently fail to recognize their own shortcomings in comprehension and overestimate their recall of important information. The health information they are given is often communicated at a very high level, 12th grade or higher, when the average American reads at the 8th grade level. One function health literacy impacts is the ability to take medicine correctly, which requires numerical skills to figure out dosages and reading skills to read directions. This is widespread. One systematic review on patient medication errors showed that from 19 all the way up to 59% of all medications are taken incorrectly. Not surprisingly, low health literacy correlates with a number of adverse health outcomes, worse reported health status, lower quality of life, and ultimately higher rates of mortality. Health literacy contributes the ability to take responsibility for one's health and healthcare decision-making, locate health information and communicate on health matters with healthcare providers, calculate dosages and interpret test results, take action to improve personal and community health, navigate in society and healthcare systems, filter, interpret, and evaluate or understanding health risks, and evaluate information for credibility and quality. Anyone in the U.S., regardless of age, race, education, or social class, can be at risk for low health literacy. However, several factors are strongly associated with limited health literacy. For example, socioeconomic status. The epidemiology on health literacy shows that adults living below the poverty level have higher rates of limited health literacy than adults living above the poverty level. There are many socioeconomic variables that are associated with lower health literacy: insurance status, educational attainment, income, occupation, and perceived social status are some examples. Disability is a factor associated with limited health literacy, in particular hearing, speech, visual, learning, mental, and emotional disabilities. Think about how these disabilities impact communication. And things that impact communication have the potential to impact health literacy. The National Adult Literacy Survey, also known as NALS, showed that more than half the individuals with vision, speech, or learning disabilities performed at NALS Level 1, the lowest level of health literacy. 48% of individuals reporting a mental or emotional condition and 35% of individuals reporting a hearing difficulty also performed at the lowest level. Some disabilities are invisible, which is why communicating clearly and designing communication materials for accessibility is especially important. In the resource list, I've included links to resources that can help with accessible communication, including a tool for evaluating documents for accessibility and an ADA's Best Practices Toolkit from the Civil Rights Division of the United States Department for Justice for effective communication. Older age is another factor associated with limited health literacy. Among older adults, health literacy levels vary by education level and access to financial resources. In fact, education mediates other risk factors in adults of all ages. Identifying as a racial or ethnic minority and speaking English as a non-primary language as factors associated with limited health literacy. Some of the greatest disparities in health literacy occur among racial and ethnic minority groups. Cultural differences and language barriers impact communication and understanding. Belief systems and customs impact response to health information. Health literacy is critical when we consider who is most at risk in our changing demographics in Minnesota. We have an aging population. The Minnesota State Demographic Center projects that the number of Minnesotans aged 65 years will increase by nearly 400,000 people to 1.3 million, or a fifth of the state population, by 2030. And Minnesota's oldest residents, age 85 and above, are expected to more than double in the next 35 years, from the current 120,000 to over 270,000. The elderly represent a population that is surviving longer with more complex and long-term medical needs. We are also becoming more and more diverse. Between 2010 and 2018, Minnesota added 5 times as many people of color as non-Hispanic white residents. The fastest growing racial group in Minnesota was the Black or African American population, which grew by 36%. Second fastest was the Asian population, which grew by 32%, followed by the Hispanic population, which grew by 24%. Nearly 500,000 immigrants call Minnesota home, a population that includes citizens and non-citizens, students and workers, and refugees who fled their home countries. In 2018, about 9% of Minnesotans were foreign-born, with the largest immigrant groups from Mexico, Somalia, and India. The most common languages spoken in Minnesota, other than English, include Spanish, Somali, and Hmong. Low education level is another factor associated with health literacy. Keep in mind, all these health literacy factors are intersectional. So, have we got any questions so far?
Nothing so far. Thanks, Catherine.
Okay. So next, let's move on to communication. Effective communication is a building block for other parts of the health literacy definition. When health information is not successfully communicated by receiver or provider, it stymies the ability to understand, process, and use the information to make informed decisions about health. Poor communication can lead to negative health outcomes. If a provider has trouble communicating what actions a patient needs to take, what's the likelihood a patient will be able to follow through? If patient education materials don't effectively communicate information, how likely is a person reading the materials to be able to use that information to make an informed decision? And if the patient can't communicate symptoms or concerns to the provider, how can the provider make an accurate diagnosis or suggest an appropriate treatment plan? Health communication occurs both verbally and in writing. Print health information includes posters, web pages, home care instructions, discharge instructions, medication labels and instructions, education materials about treatment or testing options, warnings about air quality or storms, and other public health announcements. An essential part of our shared responsibilities for health literacy is communicating clearly so that the information is understood. So, just to inject the library perspective, the Medical Library Association expanded the definition of health literacy in 2003 by creating a definition for health information literacy. Their working definition of health information literacy is the set of abilities needed to recognize a health information need, identify likely information sources, and use them to retrieve information, assess the quality of the information and its applicability to specific situation, and analyze, understand, and use the information to make good health decisions. The emphasis on health information literacy is that humans play a subject role instead of an object role when carrying out information discovery. So health information literacy is defined as people recognizing the need for health information, knowing how and where to find information about health, and knowing how to evaluate and use such information to make good health decisions. And we as librarians are uniquely qualified to help them. So what is the role of the librarian in helping people find the information they need to make good health decisions about their health? Librarians are in a strong position to advance the following multiple literacies to promote active health literacy through providing reliable and timely information on health topics. Individuals may need to be visually literate to be able to understand graphs or other visual information, computer literate, able to operate a computer, information literate, able to obtain and apply relevant information, and numerically or computational literate, able to calculate or reason numerically. So I'm doing just another question check right here.
Yeah, we're doing good.
All right. We cannot guess who has low health literacy. One of the hallmarks of health literacy best practices is applying universal precautions for health literacy to health communications. The idea behind universal precautions for health literacy is that we should communicate in a way that everyone can understand. To do this, we need to be as clear as possible. We know that everyone is at risk for misunderstanding. According to some measures, only 10% of adults have the skills needed to use health information that is routinely available to us. Applying universal precautions benefits everyone. Research shows that interventions designed for people with limited health literacy also benefit those with stronger health literacy skills. When information is clear and easy to act on, people feel more involved in their health care and more likely to follow through on their treatment plans or enact health behaviors. The Agency for Healthcare Research and Quality, also known as AHRQ, puts out a Health Literacy Universal Precautions Toolkit. This toolkit provides evidence-based guidance for addressing health literacy. It includes 21 tools that you can use to improve written communication, oral communication, self-management, and supportive systems. This is a great resource for promoting organizational health literacy. So if after class you want to dive more deeply into improving health literacy, check out the link in the toolkit in the resource list that will be provided afterwards as part of the handouts and stuff that will be posted on the event site. Our goal is to communicate as clearly as possible. The left-hand column here shows what we can aspire to in order to have clear communication. You can also think of the left-hand column as the behavior change we need to implement in order to have clear communication. The right-hand column shows how communication usually works or what we want to avoid. First, to have clear communication, use plain language. To do this, choose common words, often called living room language, that you would use to explain medical information to your friends or family. Avoid as much as possible medical terminology or jargon that may be hard to understand. For example, say stomach or belly instead of abdomen, skin infection instead of colitis, or eat less salt instead of reduced sodium intake. Use words that create images for people that people can visualize. For example, runny nose instead of excess mucus. If you must use medical terms, then explain them as well. Next, use simple messages and avoid complex ones. Keep your messages concise and to the point. Limit the information you provide to a need to know information, not nice to know information. And I know as librarians, we have a tendency to want to give people everything, but ratchet it back. So sometimes you do feel compelled to explain more than the receiver needs to know because there's often a lot of info on a topic. Research shows that few people can remember more than 7 independent items. For those with low literacy skills, the limit may be 3 or 5 items. This means that the need to know your goal is 3 items and 5 at the most. For clear communication, learn to anticipate misunderstanding and confirm understanding. Often, we assume that the receiver understands our message simply because they don't speak up, and they might not. The English language infers that this silence means that the person understands. Conversation is like throwing a ball back and forth. We have to make sure they catch the ball. Later, we will go over the teach back strategy for confirming understanding. Clarify when there's a misunderstanding. Often, we try to create understanding by repeating the same thing, only louder. Clarifying, on the other hand, entails using different language to clear up misunderstandings. In other words. Lastly, use objective, judgment-free language. It's easy to inadvertently shame people when we talk about their health behaviors. An example is using the term non-compliant. Instead of saying, "So I see that you've been non-compliant," you can say, "Okay, I hear you haven't been taking your medication a full 30 minutes before you eat." That is objective and includes facts you learn directly from the patient, so there's no disagreement or feeling of judgment. Many words that we don't think of as medical jargon might not be understood by everyone. Here's a few commonly misunderstood words. So go ahead and pop in the chat if you can tell me another word or set of words for the term cardiologist. Just think about it. Or any of the terms here, PRN, BID. Go ahead and type your answers in the chat box. Stacy, are people actually doing that?
Yeah, they are. We're getting heart doctor, lung doctor.
Uh-huh.
There's a couple of these that I don't know what they mean, but I get BID twice a day,
That is correct. Yes.
PRN as needed.
All right. You guys are good. All right. Let's continue on. So plain language sentences, some examples. Sentences written in plain language are easy to understand. Here are some examples of sentences revised for plain language. Your COVID-19 results are negative. Could cause some confusion because isn't negative bad? The plain language version of the sentence is, you don't have COVID-19. It's much more straightforward and easier to understand. The version of the second sentence, reduced sodium intake, could be confusing. Using plain language, it is simple to say, eat less salt instead. In the third example, take on an empty stomach, the literal words are confusing. What does taking something on your stomach really mean? Empty of what? Food or drink? The plain language version is simply, don't eat or drink before taking this medication. And even to expand on that, sometimes it's don't eat or drink anything for an hour before taking this medication. If they want to make, if the person wants to make sure the stomach is empty. So it's, making sure that people really understand, and maybe it involves maybe using more words, more shorter words, that type of thing. So keeping on with plain language. So what are plain language principles? In order to promote health literacy, we need to select, assess, and create print materials that are easy to understand. I'm guessing that some of you select and assess print materials. That's what a lot of library people do. And others you create print materials. So here are some plain language principles that you can use and make communication clear. And this plain language simple, we're talking about health literacy, but that could be with anything that you do, that you have to do with print or anything like that. Plain language works much better. So use familiar terms, not jargon, acronyms, or medical terminology. Chunk info. Chunking info means breaking documents into separate topics. Keep paragraphs short. Use descriptive subheadings. Use more headings and subheadings with less under each heading. Use bullet points to organize information. Organize logically. Put your most important material first and organize material in order in order of importance to the audience. Start by stating your purpose and bottom line. Include background information towards the end. Write in a conversational voice versus an academic or research voice. You want to engage the reader. One way to do that is to use the active versus passive voice. Active voice makes it clear who is supposed to do what action. It eliminates ambiguity about responsibility. Not it must be done, but you must do it. Not masks must be worn, but wear a mask. The plainlanguage.gov guidelines have a much more comprehensive list of plain language principles. Using plain language is a key component of our shared responsibility for health literacy. So if you want to learn more about plain language principles, I suggest you take a look at plainlanguage.gov. The link is in the resource list. So plain language is actually more than using plain words. It's also providing context. There are two concepts that people sometimes confuse: plain language and readability. Readability is how something is read. Readability is measured in terms of grade levels. The National Institutes of Health recommends that the readability of patient information materials be no higher than the 6th grade level. There are readability calculators that you can utilize to see the grade level of a document. These formulas are mainly based on sentence and word length, and I've used these readability calculators myself. A lot of times, if you don't notice it, you might have a sentence that runs the whole paragraph, and you never realize that you're doing that. Or you may be using words that have 4 or 5 syllables. Shorter sentences, shorter words, readability increases and grade level goes down. However, there are a number of issues with readability formulas, so they aren't good for making an overall assessment of whether your document clearly communicates info or is easy to understand. There's a lot of different readability formulas out there. So first of all, online readability scores are inconsistent and often inaccurate. Secondly, readability formulas often ignore factors that contribute to the ease of reading and comprehension. Just because somebody could read something at a certain level doesn't mean they can understand it or know what to do with it. If you rely on a grade level score, you can be misled into thinking that your materials are clear and effective when they may not be. That's because readability formulas don't take into account the user's context or the principles of plain language. By contrast, plain language addresses factors that contribute to the ease of reading and comprehension, ensuring that readers can grasp the message the first time they read it. So, the bottom line: readability, plain language, and health literacy are all important. So it is important to understand what makes each unique. Readability is how easy or not something is to read. Plain language is writing that people can understand. And personal health literacy is the degree to which people have the ability to find, understand, and use the information and services to inform health-related decisions and actions for themselves and others. So next up is a tool that you can use to assess written materials for the ease of comprehension. So I am going to go live here for a minute. All right. SAM, the Suitability Assessment of Materials, is an instrument which offers a systematic method for objectively assessing health information materials in a short period of time. SAM scores materials in 6 categories: content, literacy demand, graphics, layout, typography, learning stimulation, and culture appropriateness. Within these categories, SAM lists different factors, and for each factor, SAM has a scoring grade. This takes the subjectivity and guesswork out of assessing written communication materials. So this is SAM criteria. So here's content, and it breaks it down into the purpose and then whether something is superior, adequate, or not suitable. So here's literacy demand, again, reading levels, again, whether or not something is superior, adequate, or suitable, and that's how they do things in these various criteria. So we've got vocabulary, graphics, layout and typography, learning stimulation and motivation, culture appropriateness. And I'm going to go back up here to Let's see. So these are so here are some of the factors. Sentence construction, writing style, etc. As you can see, each factor can be scored as superior, adequate, or not suitable. Sam lists the scoring criteria. Now I want to give you a chance to apply SAM, or at least part of it. Now we're gonna go. Back here. Here are some SAM scoring criteria for the subheadings and chunking. Keep in mind that there are scoring criteria for many different factors. This is the one about subheadings and chunking. With this criteria in mind, so here's the criteria for chunking. It's superior if it lists are grouped under descriptive subheadings or chunks, and no more than 5 items are presented without a subheading. Adequate is no more than 7 items are presented, and not suitable is where there's more than 7 items are presented without a subheading. With this criteria in mind, we're going to share a link in the chat box to a printed document about Percuscus, and this is Stacy, where you go and plop that into the chat box. Please click on the link and use the SAM criteria for subheadings and chunking to give the Percuscus document a score of subheadings chunking, nothing else. Then come back to the chat box and tell me what score you would give it, superior, adequate, or not suitable. We'll take a minute for you to take a look at that document and put your answers in the chat box.
Catherine clarifying, is this the Making Numbers Meaningful or the Florida Health document?
This is the Percuscus, what parents need to know. I think, oops, yeah, that's the one.
The Hurricane Irma one?
No, all right, hang on. This is what it looks like.
I don't think I have that link.
Oh, okay. Well, we've got the document up here. You can take a look at it. We've already you can sort of take a look.
Hannah got it faster than I did.
Okay, fine. But this is what it looks like, and this is the one you can either do it from the link or you can do it from this page right here. I'll give you another minute because on this page, we haven't actually given everything totally away. Just give your assessment of it. And I'm going to guess that based on this, if ever you have had a look at it. So now that you've all basically done your own assessment, I think we can agree that this document has descriptive subheadings that only has 3 items, less than 5 presented without a subheading. So it's actually a pretty good document. It's very clear, nicely laid out, and everything's nicely chunked. So now we're going to do, hopefully, Stacy, you've got the right link this time. Now we're going to try one with food safety. Do you have that one? It's the one that's the floridahealth.gov one.
Yep, I have that one.
Okay, throw that one in the chat box. We're going to try and see how doing the same thing. Here we go. Look at the subheadings and chunking and see what you think about that one.
We're getting a not suitable in the chat.
All right. So let's look at that one. Yes. It's definitely not chunked. It definitely is got more than 7 items listed on or something like that. And somebody, usually as I've told like medical students, by the time somebody gets to the end of it, they've forgotten what the other ones are. That's what happens when you have more than 3 or 4 or 5 items listed. People just lose track of where they are in a document. So like I said, this document has no descriptive subheadings. They do not use bullet points, but there are more than 7 bullet points. According to SAM criteria, it gets a not suitable score. Subheadings and chunking is just one of the many different criteria that contribute to clear written communication and understanding, and that you can use, and something you can use SAM for. So if you want to objectively assess written health communication materials, either that you've created or you're thinking of using, SAM is a useful tool. A link to that is also in the resource list. So this is something that you can use, that if you're thinking of linking to health communication, health information materials, printed ones on your library website or something, you can use this tool to assess it to see, is this something that is going to be useful for your patrons? Or is it going to be just something that's going to be confusing and, not worth actually linking to or putting up? So now let's talk about visuals. Visuals such as pictures, drawings, charts, graphs, and diagrams can be an effective way to convey information because they fill in where words may not be understood. Visuals shouldn't be used in place of text because people can interpret visuals just as they do words in different ways. However, visuals can enhance text and help reinforce written or oral instructions. Here are some tips for using visuals in health communication effectively. Concentrate on the main message. Think about what action you want the person to take. Use images to provide visual clues. Use clear headings, labels, and captions. These help you to be clear about the purpose of the image. For instance, the image on the so here on this one here, you've got very clear images about the different types of foods. They're very clearly labeled. People can understand what's going on. Use simple, realistic pictures. Research shows that when illustrating a medical concept, there's often line drawings are most effective, but in this case, I'm using food. The food probably works better. So use color to add comprehension. So, for example, in the Pacific Northwest this summer, there were warnings about air quality due to forest fires. The numbers about PM 2.5 on their own don't mean much without context, but the public health messaging about air quality was accompanied by green, yellow, orange, red, and purple markers. Those to make it easy to understand when it was safe to go outside. Keep in mind that there are variations in the interpretation of standard images. Sometimes these reflect differences in symbolization that prevails in different cultures. For example, in some cultures, the image of an owl represents wisdom. In others, it represents death. So now let's move on to verbal communication. Here are some of the best practices for clear verbal communication. Listen carefully. Try not to interrupt people when they are talking. Pay attention and be responsive to the issues they raise and questions they ask. Use the receiver's words. Take note what words the receiver uses to describe their health concerns and use those words in your conversation. Use plain non-medical language. You might notice some overlap in this list with the print communication. With verbal communication, it's equally important to use plain language and avoid jargon. Slow down. If you talk too quickly, it's harder for people to understand new concepts or formulate questions. Speaking slower increases comprehension for people that have hearing loss or for whom English is not the primary language. Limit and repeat content. Repetition can help people remember information and give them more chances to ask questions. For example, you'll notice we're repeating some of the information in this webinar, such as plain language. Just like print communication, keep things need to know and not want to know. Remove extraneous information and limit to the essential points. Demonstrate how it's done. Instead of just telling people about something, include a demonstration when you can. For example, if you're showing how to cough into your elbow instead of your hand, act it out. I've been told it's called the vampire move. Use graphics. Just like with print communication, visuals can fill in where language may not be understood. Research shows that people with low health literacy ask fewer questions. When you say to someone, "Do you have any questions?" it's easy for the receiver to answer no. This could be because they are embarrassed, shy, don't understand, or they don't realize that there are things they need clarification on. Instead of saying, "Do you have any questions?" invite questions by asking, "What questions do you have?" This normalizes asking questions and encourages the receiver to think about what they need clarification on. It is important to confirm understanding. However, when you ask, "Do you understand?" it's very easy for somebody to just say yes. Instead, use the teach back method to confirm understanding. Is there anybody on this that actually is familiar with the teach back? If you are, just drop a note in the chat. The teach back method is a method to ensure that health information is communicated so the receiver understands it. You start by breaking down the information into small chunks. Sound familiar? You teach the first chunk, then you ask the receiver to teach it back to you in their own words. If they understand, you move on to the next chunk of information and do the same thing. If they don't understand any part of it, you reteach the information using different words. When you use teach back, it helps to convey it's not a test of understanding on the part of the receiver. One way of doing this is to say, would you mind repeating back the instructions so I can see if I was clear? The focus is on if I was clear, not them. So now let's turn to a site that can be used as a tool for health literacy, Medline Plus. Medline Plus is an online health information resource from the National Library of Medicine for patients, their families, and their friends. Medline Plus has reliable health information that is easy to understand, and it is free. Medline Plus is a tool for promoting health literacy because the information is presented with the principles of health literacy in mind. And so I'm going to switch over to a live one of that. All right. Shoot. No. Sorry. I've got something. Oh, there we go. Sorry about that. All right. You can use the search box in the upper right-hand part of the main page to search for health conditions, diagnostic and laboratory tests, or drugs and supplements. Let's just say I want to learn about heart failure. So here's a summary box for heart failure. All the top summaries are written in 6th to 8th grade language. And if we go to actually the whole thing here. So here's the summary. All the topic summaries are written in the 6th to 8th grade reading level. Note that the topic page adheres to many of the best practices for plain language. It's all chunked. They've done a nice job with chunking. There are lots of descriptive headings and subheadings with minimal text under them. They use bullet points. They use the active voice in the second person you. Another best practice for plain language is to use the first person I or the second person you as opposed to the third person. On this particular page, there's information about symptoms, diagnosis, treatment, and prevention. Another thing that's unique about Medline Plus is that although it's written for consumers, at the bottom of the topic page, there are links to journal articles and when applicable. So they're all the way down there, handouts. Clinical trials. Also on this page are links to related health topics. You can see those over here. And where available, links to information in other languages. So, and this is where they'll send you to the other languages page. If you want to direct people to information that is authoritative and easy to understand, Medline Plus is a great resource. Also, these health topic summaries are in the public domain, so you can feel free to use them and distribute them as part of any health promotion or prevention campaign. And I want to also point out too that they are printer friendly. So you can actually print out the page and it's done so it's not one of these ugly web page printouts, but a very nice page. So you can actually print them out during a patron visit. We'll go back to the page. Medline Plus has a number of other features that you can use to promote health literacy. One is a collection of easy to read health information. So they've already got them already set for you, which are written at the 3rd to 5th grade level. You can access a collection by clicking on the link in the lower left-hand corner of the Medline Plus page. Remember, low education is a risk for low health literacy. So if you have patrons with low education levels or low reading levels, check out the easy to read collection. Medline Plus also has a mirrored site in Spanish. Spanish-speaking adults have disproportionately high levels of low health literacy. This site can help reduce the language barrier. You can access the Spanish site by clicking on this link, and then you can always flip it back to English again if you need to. And as as you can see, we're in the easy to read Spanish language section as well. So that it's available both in English and in Spanish. Also, if I go back here, you go down here, there, health information in multiple languages. Medline Plus also offers a collection of health information available in multiple languages, which can help addressing language barriers that contribute to limited health literacy. Okay, this collection includes more than 55 languages. All right, so here. So that was Medline Plus. So reducing language barriers is important, but to improve health literacy, you also need to address cultural barriers to health communication. So here are some tips. Minnesota consists of many diverse populations and cultures, which are growing all the time. Culture influences an individual's health, beliefs, practices, behaviors, and even the outcomes of interventions. Every person is unique and has their own culture, shaped by many factors such as race, ethnicity, geography, education, income, religion, sexual orientation, and gender identity or health. Which can affect their health beliefs and behavior. The impact of these cultural and social determinants, language barriers, and health literacy on healthcare is increasingly important in the delivery of quality health care. Culture refers to the integrated patterns of human health behavior of racial, ethnic, religious, and social groups that include language or communications, ways in which patients and families from diverse cultural backgrounds communicate, including verbal and nonverbal clues, and how this may differ within and among cultures. Eye contact or physical touch will be expected in some cultures and inappropriate or offensive in others. Actions or customs. Differing roles of women and men in society may determine who makes decisions about accepting and following through with medical treatments. Disease-related dietary advice can be difficult to follow if it does not conform to the foods or cooking methods used by the patient. Beliefs, values, and instructions. Religious faith and spiritual beliefs may affect healthcare seeking behavior and people's willingness to accept specific treatments or behavioral changes. What culture-aware communication boils down to is tailor the message to a specific group, be aware of cultural norms and customs that influence communication, decision-making, and health beliefs and behaviors, avoid idioms and jargon. American idioms can be especially confusing for people from different cultures or for whom English is not the first language, and use high-quality translators and interpreters. You want translators to translate the meaning of the message, not literally translate each word for word. And apparently Google Translate is very bad for medical information. Utilize visuals and examples that reflect the audience. If you're using visuals in written communication, you want them to engage people, not to alienate them. Okay. So one resource you can use to improve cross-cultural communication and raise your awareness of different cultures is Ethnomed. Ethnomed contains medical and cultural information about immigrant and refugee health. You can search this site by clinical topic, or cultural group by clicking on the links on the menu bar. Within the clinical topic section, you can filter by cultural group, or if you click on the patient section, you can then filter by language. And I'm just gonna go in here. The cultural section has, I would highly recommend exploring this one because it's at a wealth of information. If you work with Native American populations, the Indian Health Service has some tools you can use to promote health literacy. Under for providers, it's right up here, there is a catalog of culturally relevant patient education materials. Under for patients, there is a section on culturally relevant health topics. IHS also has their own page on health literacy. It has health literacy training and a white paper that focuses on the issue of health literacy in Native American populations, which describes strategies healthcare professionals can use to improve communication with Native American patients. So, which brings me to the end of my part of the presentation. To summarize, we've covered health literacy is a shared responsibility. Universal precautions for health literacy ensure that we communicate in ways that everyone can understand. Clear health communication best practices include using plain language, limiting a need to know information, confirming understanding, and being aware of cultural differences. And there's free online resources you can use to promote health literacy, including Medline Plus, Ethnomed, Indian Health Service, and the AHRQ Health Literacy Universal Precautions Toolkit. To quote Helen Osborne, literacy matters in healthcare because life-threatening or potentially harmful mistakes may happen when people cannot read or understand written or viewable information. And at this point, I am going to turn it over to Stacy.
Okay, so I'm going to talk a little bit about the Consumer Health Information Specialization from the Medical Library Association. I have level 2 CHIS, so I've taken this and trained the trainer. It's been just level 1 was a game changer for me as I worked with patrons, worked with our community. So I highly recommend you look into this option. So, oh, sorry, I was on the wrong slide. You are on the right slide. So CHIS stands for Consumer Health Information Specialization. It offers training in providing health information services to consumers and recognition for the accomplishment of acquiring new health information skills. Next slide. So CHIS level 1 is 12 hours of training. Y'all just finished one of those 12 hours. Classes are virtual, on demand. Catherine and I will be offering one at the upcoming MLA conference if you want to join us for multilingual health. Next slide. And then with CHIS, you gain skills in these areas: understanding your community, health literacy, mental health resources, evaluating health information, and health equity. So Minitex has set up goal for at least one individual in each of the 12 regional public library systems to complete the CHIS specialization. And we're really hoping that staff from our academic partners, special libraries, join in that challenge. So to get your CHIS, you earn the 12 credits. You apply for sponsorship because we're part of the Region 6 if you're in Minnesota, but it's all across the nation. So regardless of what state you're in, you are part of NNLM. Next slide. We're going to jump to this slide because this is the most important one today. If you want to claim your credit, this is the evaluation link. There it is. And so by doing the evaluation, you'll get the credit. It'll give you a code that you can then apply towards the CHIS credit. So you'll go to medlibed.org, which I'll put in the chat as well. Yeah. But if you click on the My Learning, enter that enrollment code that you get after you finish the survey, and then it'll be added to your transcript. Next slide. And then you can continue the training by participating in these Minitex courses. Again, we have 2 more, and then this one and the previous one are recorded and will be available. And then there's also additional training at the nnlm.gov/training. And there we go. And then NNLM, it is free to be a member of NNLM. And so because if your organization joins NNLM, you'll get access to funding, free training, document delivery, emergency preparedness. There's so many resources with it that you can trust that are freely available within the network of the National Libraries of Medicine and your local region. And then finally, this is us. So again, I encourage you to sign up for one of the future classes through Minitex. Join us at MLA if you're available. And then also for 2025, I will be working with Minitex to put together a cohort of people who through 2025, so over the course of 12 months, will earn those 12 credits together and get everybody motivated and completed with their level 1 CHIS. So if you have interest in that, please reach out to me. Otherwise, thank you all. I hope you have a good day. That is our presentation. If you have questions, we'll hang out for a few more minutes. Feel free to throw them in the chat or unmute yourself.
I think they can unmute because we've got just a couple left.